Cardiovascular diseases are the leading cause of death worldwide, killing up to 17.9 million people yearly. One of the big symptoms for many of these diseases include cardiomegaly, which is an underlying condition and symptom that may not be directly easy to diagnose. The prevalence of cardiomegaly was said to be on the rise, estimated by over 50% in the last 30 years, and can be also a silent condition. This means that a medical examination may be the only indicator of this condition in certain cases, and it is estimated that up to 20% of the general population has some degree of cardiomegaly.
The heart consists of 4 chambers, and cardiomegaly is when any of those chambers becomes bigger than usual. For example, if there's malfunctioning in any of the valves in the heart, such as a leak, it can lead to one of the chambers increasing in volume or buildup, leading to cardiomegaly. Unfortunately, people are oblivious to this condition, often until it is too late and they have developed other life-threatening diseases.
And as you can see with the X-ray comparisons here, it can be seen that both the cardiac width and the thoracic width are significantly greater in the chest X-ray with cardiomegaly versus the one without.
The lack of awareness leads to misdiagnosis and underdiagnosis of cardiomegaly, which causes delays in treatments. Lower-income communities may not have specialists who can diagnose such conditions, which affects overall diagnosis issues as said in our talk with Ose Bote. Furthermore, this reinforces the need and gap to further healthcare access for populations with lower incomes or limited access to healthcare, which may be at higher risk for worsening health disparities.
This is why we're introducing Project Heartscope, which currently focuses on using binary classification and machine learning systems to detect cardiomegaly from X-ray scans. The overall goal of this project is to develop machine learning models for various heart disease and condition classifications and have a blog to inform people about these different conditions, prevention methods, and ways to live a better lifestyle for both rural communities and urban communities. The UN Sustainability Development Goals we aim to focus on is primarily good health and well-being, reduced inequalities for global health efforts, and quality education for people to be more aware and prevent such health conditions.
In terms of user feedback and validation, we talked to Ose Bote, who we are planning a future partnership with, possibly gaining access to datasets for specific communities in Ghana, and this was his feedback of the innovation and idea.
And so with the initiative or with the model that you are building, it would be very helpful if we can detect things like that just through an X-ray.
We also spoke with Barton Wells, CTO of DexaFit, and we learned that our model and mission differ from the current status quo.
Our team was also able to conduct a global survey with 545 individuals in which 64% of them were in support of artificial intelligence in clinical diagnosis situations for heart disease and conditions. Additionally, from a survey for 94 people globally, 79% of them were somewhat not aware of risk factors in developing problematic heart conditions. As for future steps, we plan on expanding our model base to add various types of models for a wider range of diseases and conditions, such as our heart prediction model, as well as improve the accuracy of our current cardiomegaly detector by training on personalized data for communities. Additionally, we want to expand our target base to not only encompass clinical integration, but also to add some of our models to add features and include donations and funding to support our innovation, but also nonprofits working for our cause as well. Finally, we're implementing a blog to increase awareness and education of these heart conditions, and would like to further this feature by inviting professionals in the industry to contribute and ensure the best of the best information is being relayed to our audiences.
With so many people suffering from these conditions, our innovation can help tens of millions of people, which is why we started our journey. It also has the potential to be implemented to thousands of clinics globally, starting from areas in Canada and the US, and pursuing our partnership. We are proud to be advancing healthcare, one bee at a time.